let's start with your work in Asia about the human trafficking and child labor over there. What is your finding?
Well, I have been working on human rights issues for many years, including in Southeast Asia and along the Thai-Burma border. And in my work on human rights, I kept discovering the special vulnerabilities of children and youth, young people. And one of the underpinning rights of the child that I think is so important and also is a critical piece of their vulnerability is their right to identity. And often the lack of identity or legal documentation or a birth certificate that children often have, whether they're crossing the border or whether they're from a hill tribe community up in northern Thailand. So as I've been focused on that particular lack of a right to identity, it has a very strong link to issues like child trafficking, and also sexual exploitation of children, and also an important issue for children living in orphanages and other institutions. As it relates to Thailand, I think it is especially important given that Thailand this year is a Tier 3 country in the Trafficking Victims Protection Act, that the State Department has designated them as Tier 3 this year, which means that the government is really not putting enough effort into combating human trafficking in Thailand. So I think one of the things that the report points out is the vulnerability, the exact thing I was saying, the vulnerability that's attached to populations like migrant populations and hill tribe populations and stateless children in the north and other parts of Thailand, as well as minorities moving across borders. They tend to be especially vulnerable to trafficking because the traffickers can confiscate their documentation, or they lack any documentation in the first place. So children can disappear and no one knows they're gone because there's no record of them. So I think this is an important piece of the puzzle of trying to combat human trafficking, especially for sexual exploitation and of children. The report also notes that the Thai government needs to do a better job at identifying victims, and I think that presents a challenge when migrant communities and others do not have citizenship papers or birth registration or other legal documentation. And I think it's incumbent on the Thai government to do a better job at providing that legal documentation and then recognizing when there are especially vulnerable populations, including children. Three-quarters, I believe, of the victims that the government has identified for trafficking in Thailand are children. So this is very much an important piece, and I think there are ways to manage identity and legal documentation and status better. One of those ways is I've started a new nonprofit called Each Inc., because each child has a story, and the whole mission behind Each Inc. is to provide new technology tools to practitioners and others working to protect children, and to provide them tools and easy ways to use mobile phones and web and cloud-based computing to keep track of each child's identity and their family history. That can allow for practitioners and social workers who are working with children to find better solutions for each child. It also has the potential, if more people use advanced technology or innovations, simple, not complicated, but if more people are focused on keeping track of each child's identity, would allow then the government to work with NGOs to aggregate data, to track individual child cases even across borders with neighboring countries like Laos and Cambodia or Vietnam or Burma. And so I think we're trying to provide some proactive and positive tools that can help address this lack of identity for especially vulnerable children.
Will this tool with this device or this program apply for the global or just in
Yes,
Asia?
yes, it will. No, we're hoping to begin piloting it, a child registration tool in Asia, because we have partners who
In
need.
which part of Asia?
Hopefully in Chiang Mai, in northern Thailand, working with both the Burmese community as well as the indigenous Thai community there, specifically
Have you
focused
already
on children.
launched this program?
No, we're planning to do that in early 2015. We're launching a Kickstarter to raise some money, but we have partners already in place who are asking for this type of assistance in Cambodia and in Thailand, and then also in several countries in Africa and in Latin America as well.
Could you give more detail how this technology can help the children?
Well, if you can imagine, say, even a healthcare worker, a hospital, or some other organization working with children comes across a child, they don't know who they are or where they've come from, or even an abandoned baby in some cases. And it's very difficult to find out and to investigate what that child's story is. So that's the hard work that many people are trying to do, and what our technology is trying to do is help with that, make it easier. So make it easier for social workers to investigate cases, each child's case, and then to be able to very easy and simply record it using mobile phones, to also be able to create a child record, a very simple child record, but then being able to use mobile technology to update that record. So you can imagine sending in a text that provides a status update on each child, and by providing these very simple tools, I think we can provide people who are already working with the children a way to improve their practice, improve their programs, and to find better solutions for each child.
But how can we trace them? Because you just mentioned that they are mostly invisible.
Yeah, well, no, that takes effort, and that takes individuals willing to do that work. But there are individuals already working with these types of children, and those are our partners, and they're doing amazing work with very few resources and under very difficult conditions. And so what we're trying to do at eJink is provide them technology tools that will make their jobs easier and provide them with the resources they need to protect children better.